Welcome back to the Big Data channel, where we will briefly discuss the breaking news in the world. Before continuing to the news topic, don't forget to subscribe, like and press the bell so you don't miss the next breaking news. Not corona. Here are the 10 deadliest viruses on Earth. Data from the World Health Organization, WHO, proves that the majority of new coronavirus patients spread across the world have recovered. From the number of infections reached 157,476 people in 155 countries as of March 15, the recovery rate reached 75,953 people. Virologically, the type of coronavirus that causes COVID-19 is not too deadly. At least, there are 10 other viruses that are more deadly than the new coronavirus, launches Live Science, which are as follows. 1. Marburg Scientists discovered the Marburg virus in 1967, when a small-scale outbreak broke out among workers in Germany. They caught the infection from monkeys brought from Uganda. Marburg is similar to Ebola, which causes a high fever. This very high fever often causes shock, organ failure, and then death. The mortality rate in the first outbreak even reached 25%. However, in 1998-2000, the death rate reached 80% during an outbreak in Congo. 2. Ebola. The first known outbreak of Ebola in humans occurred in Sudan and Congo, in 1976. Ebola is transmitted through contact with blood or other body fluids, as well as direct contact from infected people or animals. There is more than one type of Ebola virus, and the degree of danger varies. Elke Mulberger, an expert on the Ebola virus at Boston University, explains that one type of virus, Ebola restin, does not make people sick. However, the Bundibugyo species has a mortality rate of up to 50%, even up to 71% during the outbreak in Congo. 3. Rabies. Although in the 1920s a rabies vaccine was invented, cases are still very high in India and Africa. The rabies virus destroys brain cells. It's a very, very severe disease, Mulberger said. In fact, humans have antibodies to fight rabies. But, if the animal is not vaccinated against rabies and is exposed to the virus, then bites us, it is almost 100% certain that you will die, he continued. 4. HIV. In today's modern world, HIV can be the deadliest virus. An estimated 32 million people have died from HIV since the disease was first discovered in the early 1980s. HIV is one of the saddest killers, said Dr. Amesh Adalja, an infectious disease expert for the Infectious Disease Society of America. Antiviral drugs that have been created allow a person to live for many years despite being exposed to HIV. However, in some poor countries, HIV infection is still very high. WHO says, in poor and less developed countries, HIV infects as much as 95% of the population. As many as 1 in 25 Africans is HIV positive. 5. Smallpox. In the 1980s, the World Health Assembly declared a world free from the smallpox virus. But before that, humans had been fighting this virus for thousands of years. Smallpox kills 1 in 3 people who are infected. Smallpox fighters often survive with permanent injuries and blindness. Mortality rates in countries outside Europe are higher. In the 20th century alone, smallpox killed 300 million people worldwide. 6. Hantavirus pulmonary syndrome, HPS, first became a concern in the United States in 1993. At that time, a resident and his partner who lived in the Four Corners area died of suffocation. Several months later, medics discovered the hantavirus from mice living in the house. Today, more than 600 people in the United States have HPS, with a mortality rate of 36% according to the Centers for Disease Control and Prevention. The virus is not transmitted between humans, but from the feces of infected mice. 7. Influenza. During flu season, more than 500,000 people in the world die from the influenza virus. However, sometimes some types of influenza viruses spread more quickly, resulting in higher mortality rates. The worst flu pandemic in history was the Spanish flu, which broke out in 1918. This virus infected a third of the world's population, and killed 50 million people. 8. Dengue. The dengue virus first appeared in the Philippines and Thailand in the 1950s. This virus lives in tropical areas, including Indonesia, and is transmitted through the Aedes aegypti mosquito. Each year, dengue infects 50 to 100 million people worldwide. In Indonesia, dengue continues to spread from year to year. 9. Rotavirus. Rotavirus is the leading cause of severe diarrhea in infants and children. This virus also spreads very fast. In poor countries, the mortality rate from rotavirus is very high because patients are dehydrated. The WHO estimates that 453,000 children under the age of 5 died from rotavirus in 2008. 10. SARS-CoV, the virus that causes respiratory distress, or SARS, was first discovered in 2002. This virus is different from SARS-CoV-2, the cause of the current COVID-19 outbreak. WHO said, this virus first emerged from Guangdong Province, China. After the outbreak in China, this virus then spread to 26 countries. This disease causes fever, joint pain, and pneumonia. The death rate from this disease reaches 9.6%, and until now there is no vaccine. A glimpse of today's breaking news. Wait for our next breaking news. Thank you for watching this news.